Good afternoon, leaders from NCGG and participants. Today, we are not presenting a healthcare insurance scheme. We are presenting a governance journey, a journey of how the Maldives transformed healthcare access for an entire nation through Aasandha, and how that success now requires the next generation of governance reforms.
This slide presents the central focus of the study, why Aasandha matters for universal health coverage and good governance in the Maldives. The research problem is therefore not whether Aasandha has improved access. The evidence shows that it has. The real issue is whether the system can remain financially and institutionally sustainable in the long term. This study evaluates Aasandha across 6 key governance dimensions: accessibility, equity, financial protection, accountability, efficiency, sustainability. The central research question is, has Aasandha achieved universal health coverage through good governance? This slide explains the methodological and analytical framework used to evaluate Aasandha's contribution to universal health coverage through good governance. The evidence base includes primary data from a 30-item citizen perception survey with 147 valid responses, and secondary data from Aasandha, hospitals, the Ministry of Health, WHO, World Bank, and OECD sources. The analysis uses descriptive statistics, trend analysis, and triangulation by comparing survey findings with institutional and financing data to strengthen reliability, validity, and policy relevance. The study follows the research onion framework. It adopts a pragmatic philosophy, as the research is policy-oriented and focused on practical evidence for healthcare financing reform. The approach is deductive, guided by UHC, good governance, and healthcare financing frameworks. The methodological choice is quantitative, using a policy case study strategy with Aasandha as the main health financing mechanism in the Maldives. The time horizon combines a cross-sectional citizen perception survey with 2012 to 2025 trend analysis, allowing the study to assess both current public perceptions and long-term utilization and expenditure trends. The analytical framework links governance dimensions to the Aasandha scheme and UHC outcomes, covering accessibility, equity, financial protection, accountability, transparency, efficiency, sustainability, utilization, and citizen satisfaction. This slide shows that Aasandha has expanded healthcare coverage and access, but also increased financial pressure on the system. Beneficiaries increased from 330,373 in 2020 to 381,107 in 2025, showing wider coverage and greater reliance on Aasandha. Aasandha expenditure also rose from 2.01 billion Maldivian rupiah in 2020 to 3.25 billion Maldivian rupiah in 2025, an increase of about 62%, reflecting higher service utilization and expanded healthcare access. In 2025, the largest expenditure areas were inpatient services at 44.1%, outpatient services at 24.5%, diagnostics and laboratory services at 13.7%, and overseas treatment at 9.8%. Overseas treatment remains a major cost area, with more than 390 million Maldivian rupiah spent, mainly due to gaps in local specialist services. Citizen survey findings also show strong public confidence in Aasandha, especially in financial protection, accessibility, equity, and overall satisfaction, while also highlighting the need to improve service quality and waiting times. The key message is that Aasandha has strengthened universal health coverage, but sustainability now requires stronger cost control, provider oversight, local specialist capacity, and value for money monitoring. This slide summarizes the main governance assessment of Aasandha. The findings show that Aasandha performs strongly in 4 key areas: accessibility, equity, financial protection, and service utilization. This confirms that the scheme has made major progress toward universal health coverage in the Maldives. However, the study also shows that cost containment is only moderate, while accountability, monitoring, transparency, and long-term sustainability require strengthening or reform. The key issue is the UHC sustainability dilemma. The same achievements that show Aasandha's success also create pressure on the system. First, Aasandha improves access, equity, and financial protection. Second, this leads to higher utilization, including more OPD visits, admissions, private sector use, and overseas care. Third, higher utilization increases expenditure and specialist service demand. Finally, this creates the need for a stronger governance response. The policy question is therefore not whether universal health coverage should be sustained, but how it can be sustained without weakening access. This slide presents the recommended roadmap for sustaining Aasandha and universal health coverage in the Maldives. The main message is that Aasandha should be strengthened through governance reform, not by restricting access. The roadmap has 3 phases. Phase 1, governance strengthening, 1 to 2 years. The immediate priority is to improve accountability and transparency. This includes developing a healthcare financing dashboard, strengthening appointment accountability systems, improving claims auditing, and publishing annual sustainability reports. Phase 2, system strengthening, 3 to 5 years. The medium-term focus should be improving healthcare capacity. This includes expanding domestic specialist services, upgrading regional hospitals, introducing strategic purchasing reforms, and developing a national healthcare sustainability framework. Phase 3, long-term sustainability, 5 to 10 years. The long-term focus should be on financing reform and reducing dependence on overseas treatment. This includes assessing future financing reform options, exploring risk-based financing models, building domestic specialist capacity, and reducing overseas treatment dependency. The end goal is sustainable universal health coverage based on accessibility, equity, financial protection, accountability, efficiency, and sustainability. The final message is that Aasandha has already achieved major progress, but its future depends on stronger governance, better resource management, and strategic investment while protecting healthcare access for all citizens.